Once again, welcome back to our channel Ach'z. So today in this section, we are going to discuss about the complete preparation guide or the topic prediction for your OET exam 12th July 2025. So that will be on second Saturday. I know that many students booked their seats for 12th of July. So we are going to discuss about the Wlrs section topics which you need to concentrate in detail. So let's start with our section without any further delay. So for each and every module, I will suggest some topics you must prepare with. Okay. So first we will start with writing module. So I don't want to make this video too long. So I will try to make everything very concise. So as you know, the total 45 minutes you will get for writing module, and you need to write a profession specific letter. So this time you need to concentrate on referral letter and also transfer letter. So under each category, I like to give 5 questions for your preparation purpose. First, we will discuss about the referral letter. So the first one is diabetic foot ulcer. That's the topic. You need to write a letter to podiatrist. And your keys: uncontrolled diabetics, infected ulcer, home nurse reports the worsening of the condition. The second one under referral letter only, the topic is mental health concerns, which means the postpartum depression. You need to write a letter to psychiatrist, or that will be like mental health nurse. So your keys: 3-week postpartum mother, sign of depression, social withdrawal. Like that, they will give the details because we can't able to include the entire letter in the video. So that's why I just give the keys. So the third one is COPD exacerbation. You need to write a letter to respiratory specialist. And the key factors: smoker, frequent breathlessness, nebulizer used at home. Fourth one, the topic is recurrent UTI episodes. You need to write a letter to urologist. And to the key information: the patient, a female, postmenopausal, then multiple infection in 3 months. And to the last type under referral letter, the topic is breast lump investigations. You need to write a letter to breast clinic. And to the key information: lump detected during routine checkup, then family history of cancer. So that's about the referral letter topics you need to concentrate for this particular test day. Now about the transfer letter, the first topic is stroke management. You need to write a letter to rehabilitation unit. The key information like post-ischemic stroke care, right-sided weakness, speech therapy required. Second one, post-orthopedic surgery, or that may be like hip replacement. You need to write a letter to aged care facility. The key information: the gender will be there, postmenopausal, multiple infection in 3 months. Then the next one, third one, wound care for pressure ulcer. You need to write a letter to community nurse. The key information like stage 2 ulcer, immobile patient, dressing routine shared. Fourth one, dementia with wandering risk. So you need to write a letter to dementia secure aged care unit. And to the key information, require supervision, unsafe at home, support with ADL, which means activities of daily living. You need to take care about the major abbreviations. You should study the major abbreviations. The last one, end-stage cancer. You need to write a letter to palliative care facility. The information like deterioration in condition, pain not controlled with oral medications, need symptom control and emotional support. So that's about the 10 different topics under transfer letter and the referral letter. So this is for your preparation purpose. Under each category, what all area you need to focus. So that is the thing we are mentioning in this video. Now we will discuss about the next module. Almost the students are requesting to suggest some topics under this reading module only, especially for part A section and all. So reading module total will be 60 minutes or 1 hour. For that, the part A carries 15 minutes of time. You will get 20 questions in 4 different short tests. That test will be labeled as A, B, C, D. You know these all things, and you will get short answer questions, match the information type of question, and also sentence completion. Now we are going to see some topics you need to concentrate under each part. Coming towards the part A section, anaphylaxis, pneumonia, meningitis, snake bite or about poisoning, cellulitis, asthma, Parkinson's disease, epilepsy, Bell's palsy, otitis media, bipolar disorder, burns injuries, pressure ulcers, breast cancer, and hypolipidemia. So these all are the area or the topics you need to focus under part A section. As usual, you need any preparation sample, means I am not saying that you will get the copy paste of that, but you need to be familiar with the topic and you need a sample, means you can just comment about that which topic you need. I will publish that in our community tab or in our Facebook page. Okay, you can just check out the community tab in between. So there, in the sense, we can write and give the materials. Coming towards the part B section, you will get 6 short tests that will be related to workplace related. We will say it as workplace related extract, and the question category will be multiple choice along with 3 options. For this particular category, you need to concentrate on the main point, purpose, and to the detail. Okay, so let's check out which are the topics under part B section. The topics: medication year protocol, infection control update, which means like a staff meeting, nursing supervisor explains shift handover rules, pressure ulcer risk assessment protocol, falls risk prevention policy, sharps disposal instructions, notice on fire safety drills, internal update on code blue, which means about the emergency response roles, reminder on using new electronic health record system, pre-operative checklist for nurses. So these all are the topics under part B section. If you already have the materials, means you can just give importance to these topics. Then about the part C section, you will get a long opinion test. You will get 2 long tests, and here the multiple choice will be along with 4 options. And for this particular part, you need to concentrate on writer's opinion, attitude, and inference based question. So let's check out which are the topics you need to concentrate on. The first one, why nurses leave the profession early. Second one, technology and human touch, that means the balance in patient care. Third one, digital health records. Next one, DNR conflicts. Review on sleep and shift work in nurses. Mobile apps for nurse training. Teamwork in multidisciplinary care. Nurse leaders in crisis management. Mandatory flu vaccine for health workers. Review on AI and triage in emergency care. Last one, burnout and emotional labor in nursing. So these all are the area you need to focus under part C section. I hope while mentioning clearly about the topic, it will help you out in your preparation journey. Anyway, you will get 10 more days for your final preparation. That's why I thought of releasing on the 1st of July itself. Now we will discuss about the listening module. The total minutes will be 45 minutes. You will get some case notes or presentations or any dialogues in the workplace scenarios. And they will be talking about the medication dosage or about the wound update or surgical management update, like that conversation you will hear. Now for your better understanding, I will arrange some sample topics, and I will provide that in set wise, okay, A, B, C, like that, for your better understanding. Rather than simply mentioning about the topic, you will be clear about the area or how the listening will be, the audio will be, or what you can expect. Now the first set, the part A, burn dressing explanation. In that part B, shift coordination briefing. C, public health forum on vaccination. Second set, part A, nurse gather information on post-minor stroke. B part, safety in medication storage. And C part, nurse shared ICU experience. Just give importance to the topic, okay. Then coming towards the third set, part A, sports injury triage. B part, bed sore prevention meeting. C part, research on hydration in hospital patients. Fourth one, part A, elderly patient talks about sleep problems. B part, training on CPR changes. C part, podcast on this cultural awareness in nursing. Fifth set, part A, discussing fever pattern in dengue. B part, risk management audit. C part, talk on ethical dilemmas in pediatrics. Sixth one, part A, including teen recovering from appendectomy. B part, discussion about patient rights. C part, AI application in nursing. And to the last one, part A, pain assessment after surgery. B part, antibiotic stewardship policy. C part, international nurse recruitment podcast. So that's about the 7 different set. Okay, you will get more listening audios in the YouTube platform itself. So try to check out or try to search with this topic. Then you will get to the somewhat same content. Now coming towards the last module, speaking section, you will get 2 role play cards. So I just included 15 role play card scenarios for your preparation purpose. So we will check out each and every. So the first one is diabetic diet counseling. So you need to educate a newly diagnosed patient on diet and also about the sugar monitoring and about exercise. Very common topic, and we will always give importance to these topics like hypertension, diabetics, like that. Anyway, the second one, asthma management in teen. So you need to advise a teenager and parent on inhaler use, then trigger avoidance, and also about the school activities. Third one, wound care instructions. Teach a patient about the post-surgery, example like this abdominal wound and all, on the dressing changes. Fourth one, pre-op anxiety. That's also the area like child surgery. So you need to reassure the parent before surgery, like the tonsillectomy. And you need to explain the process and about just answer to all the queries of the parent. Then fifth one, dealing with dementia confusion. Like you need to be calm and guide a relative who is frustrated with a dementia patient's confusion. Sixth one, child with suspected ear infection. You need to reassure the parent and explain about the each and every steps. Seventh one, teenager with acne issues. Provide treatment options and give this skincare advices. Eighth one, stroke patient in rehab. So you need to explain the recovery plan and also about this physiotherapy. Ninth one, mother anxious about this toddler's delayed speech. So you need to suggest the referral and also the support system. 10th one, teen girl with irregular periods. So you need to discuss about this menstrual cycle, when to seek further advices. 11th one, patient with bulimia nervosa. So you need to ask about the routine, about the eating habits, and you need to explain about what is bulimia nervosa and talk about the possible treatment strategies. 12th one, patient admitted for septoplasty. So you need to reinforce the patient about the post-surgical care, the recovery period, and also answer to all the queries. 13th one, patient with cirrhosis of liver. So you need to educate the bystander, talk about the possible treatment again, and provide the suggestions to get over this alcohol addiction. What all are the steps or what about the treatment regimen again. Then the 14th one, patient with coronoid fracture. So you need to explain about this surgical management, reassure the patient, talk very tactfully, and advise on different treatment options. And the last one, pediatric burn care. So you need to explain about the dressing, pain relief, and also the scar management to your parent. So that's about the 15 role play card scenarios you need to concentrate for this 12th of July 2025. So it's always better to take a mock test, at least the weekly mock test, or prior to your exam you need to take a mock test to know about your level. So definitely it will boost up your confidence. And if you have the peer group, that means your friends who already completed OET exam with a good band score, means you can just seek out for the assistance in this writing and speaking section. but there also you need to use this official marking criteria. Okay, it's not about simply depending on them. You need to use this official marking criteria and take care about these medical vocabularies or the terminologies, abbreviations, especially related to the recommendation and all. So you need to concentrate and study some common vocabulary, especially in the listening module, then speaking some phrases. These are things we already updated in this channel. So try to go through the playlist, or in different platforms you will get to the common phrases and all. If you are under an institute, means they will also provide that. So try to study some medical terminologies, the common abbreviations and all. And you should know about the OET exam rules and criteria. About if you are using this technology, that means OET at home and all, means how to use this technology. Everything you need to be thorough with. Okay, don't be confused prior to the exam date. So all the very best for your test day. Do well. God bless you all, and try to convey about your experience soon after the exam. Anyway, I will come out with the question paper discussion soon after the test. We will discuss about all the available question booklet. It's not about any particular country and all the available question booklets we will discuss during the review section. Other than that, if there is any other question booklet, means the students also will share that in the comment box. So like that you can know about the current trend, what you need to concentrate. So if you are planning for upcoming OET exams, means try to watch out this preparation guide and the review videos to be updated. So thank you so much for your time over here. So try to concentrate on the areas which we mentioned in this video, and do subscribe and watch on this page to get notified about all the recent update. God bless you all.